Hello, welcome to another episode of The Diary of an Intern Pharmacist, brought to you by the 360 Degree Pharmacist, a program that is geared towards educating and informing you about the challenges of the 360 Degree Pharmacist while interning as a pharmacist, and also provides solutions as regarding these challenges that are usually encountered by intern pharmacists in Nigeria. Now, if you're yet to subscribe to this channel, please do well to subscribe so that we can have a wider reach, because someone else needs the information that you are actually listening to just as much as you need it. On today's episode, we shall be looking at a syndrome that I call the all-knowing syndrome. Due to the peculiar training of pharmacists and the thought that they are the drug lords, newly inducted pharmacists going into their intern roles carry on this burden, this pressure that they are supposed to be all knowing as regards medication. So there is this inadequacy they feel whenever a patient walks into the pharmacy, especially in the community setting, requests for a particular drug, and they are not able to provide sufficient information as regards that particular request. Some of them even start feeling depressed and feeling less of themselves, that they could not perform because of that popular idea. The truth is, pharmacy is a broad course. I don't think it should even be called a course. It should be called an institution, because just one drug is enough to be called a course of learning. Then you have to be able to understand many things about several drugs. So it's usually an overwhelming task, and as such should be taken one at a time. So do not feel so bad when you can't give in the required information that you should at any point in time. Rather, you should take on this position. Number one, whenever a customer walks into the pharmacy and requests for a particular drug and you do not have sufficient information for it, kindly ask for the permission of the customer or the patient to make a quick search on that particular drug using your reference book. That is why your reference book is there. And it's even more interesting these times because you can have your reference book on your mobile devices. Also, take some time daily to research on a particular aspect of information that you don't know. It could come as daily request. So let's say today in the pharmacy they requested for a particular drug and you don't have sufficient information. Because okay, today I'm going to give 30 minutes of my time to study this particular drug. It's also important that you explain to your patient the modalities of your training, especially for those who may not be familiar with what pharmacy entails, pharmacy practice entails. Some you see it, some patients will be like, anytime I come to someone, this person is always let me check. And it be like saying no something. Yes, we could have you'll see a lot of this kind of patient. So it is your duty to explain to them. Don't wait for them to even begin to think it. Let them have the explanation. So you say, oh, sorry, I have to check for this because these drugs have the capacity to change the course of your life. So I would have to be more deliberate in handling it or giving information as regards it. So please, this is done in your interest. So in summary, how can you solve that the all-knowing syndrome? How can you come out of it? Number one, understand that no one is an island of knowledge. Getting the knowledge of medication is a continuous process that doesn't end. Number two, work on yourself, daily equip yourself, give time to study your profession every day. Number three, don't hide your vulnerability when it comes to these things, because just like I said, drugs have the capacity to affect human life. So don't say, oh, okay, maybe I see, but I don't sabi anything. Inform your patients or educate them on the modalities of your profession. The need why you always have to search this, search that, check on this and check on that whenever you are attending to them. Get on those reference materials on your mobile devices and join knowledge groups that will help in what? In refreshing your memory as regards what you've learned in school, or the daily updates of medications and health generally that's happening in the world. If you're yet to subscribe to this channel, please do well to subscribe to it right away. Till I come your way again, keep being fabulous and yourself. Bye bye.